As we age, one of the most common and concerning issues many people face is a decline in balance. This can range from a slight sense of unsteadiness to more severe cases where the risk of falling increases. For older adults, particularly those over 60, balance problems can significantly impact daily life and independence. This isn't just frustrating, it can also be dangerous. But why does this occur? What exactly happens in our bodies as we age that makes it more difficult to stay steady? The science behind balance. Balance is the ability to maintain an upright position and orientation in space, preventing falls. This complex process involves the integration of multiple sensory systems, including the visual system, the vestibular system in the inner ear, and proprioception, the body's ability to sense its position in space. The brain combines input from these systems to help us maintain stability. When one or more of these systems are compromised, balance problems can arise. As people age, the efficiency and effectiveness of these systems gradually decline. This decline is typically not abrupt, but happens over many years, leading to subtle changes that accumulate until balance problems become noticeable. Let's break down the 11 main factors that contribute to balance issues in older adults. Muscle weakness. One of the most significant changes that occur with age is a decrease in muscle mass and strength. This process, known as sarcopenia, begins in the 30s but accelerates after age 60. The loss of muscle mass, particularly in the legs and core muscles, weakens the body's ability to stabilize itself. Furthermore, a lack of muscle strength can make it difficult for older adults to recover from a stumble, increasing the risk of falls. Joint stiffness. As people age, cartilage in the joints breaks down, and the synovial fluid that lubricates the joints decreases, leading to arthritis and reduced flexibility. The most common joints affected by stiffness are the ankles, knees, and hips, which make it harder to make the quick adjustments needed to maintain balance. Stiffness in the joints also affects proprioception, the ability to sense the position of the body in space, which is essential for balance. Changes in the vestibular system. The vestibular system, located in the inner ear, plays a critical role in balance. It detects movement and changes in the position of the head, sending signals to the brain to help maintain equilibrium. As we age, this system deteriorates, which can lead to dizziness, vertigo, and a general feeling of unsteadiness. Decreased proprioception. Proprioception is our sense of the position and movement of our body parts in space. It relies on sensory receptors located in muscles, tendons, and joints. These receptors send signals to the brain that help coordinate balance by informing it of the body's position. As we age, the sensitivity of these receptors diminishes, and the brain's ability to process this information becomes less efficient. The loss of proprioceptive input is one reason why older adults may have trouble walking on uneven surfaces or maintaining balance when they're distracted. Vision changes. The eyes help us detect obstacles and orient ourselves within our environment. As we age, changes such as cataracts, macular degeneration, and glaucoma can impair vision, making it harder to maintain balance. Poor vision increases the risk of falling because it reduces the ability to judge distances, navigate uneven terrain, and detect potential hazards in the environment. The decline in visual acuity, particularly in low-light conditions, makes it difficult to maintain stability, especially when walking at night or in dimly lit areas. Neurological decline. As the brain ages, the processing of balance-related information becomes slower. The central nervous system's ability to process sensory input and send out coordinated motor responses decreases with age. As a result, older adults often find it harder to adjust their posture or movements in response to environmental changes. Medications. Another factor contributing to balance issues in older adults is medication use. Many older individuals take medications for various chronic conditions, such as hypertension, diabetes, and depression. However, certain medications, especially blood pressure medications, antidepressants, and sedatives, can have side effects that impair balance. Research published in The Lancet shows that polypharmacy, the use of multiple medications, is common among older adults and can contribute to balance problems. Cognitive decline. Cognitive decline is another factor that can affect balance. As the brain ages, its ability to process information quickly and make adjustments decreases. In addition, conditions such as dementia and Alzheimer's disease can impair the brain's ability to integrate sensory inputs necessary for balance. Research shows that cognitive impairment is a strong predictor of falls in older adults. Vitamin B12 deficiency. Vitamin B12 plays a crucial role in maintaining the health of the nervous system, including the peripheral nerves and the myelin sheath that protects them. A deficiency can lead to nerve damage, which may affect coordination and balance. As we age, the body's ability to absorb vitamin B12 decreases due to changes in the digestive system, such as reduced stomach acid production. This can result in lower levels of B12, leading to symptoms like numbness, tingling in the hands and feet, difficulty walking, and even cognitive impairment, all of which can impact balance. It's important for older adults to monitor their B12 levels and consult a healthcare provider if they experience unexplained balance problems. Dehydration. As we age, the body becomes less efficient at maintaining fluid balance, increasing the risk of dehydration. This can reduce blood volume, causing dizziness and lightheadedness, impair muscle function, and affect cognitive abilities, all of which can contribute to balance issues. Dehydration can also worsen the effects of medications that increase urine output, further increasing the risk of falls. Staying hydrated is crucial for preventing these problems and maintaining balance in older adults. Fear of falling. Finally, the fear of falling is a psychological factor that can worsen balance issues in older adults. Many people who have experienced a fall develop a fear of falling again, which leads them to avoid certain activities or move more cautiously. This fear can result in a loss of confidence and a reduction in physical activity, which in turn exacerbates muscle weakness and joint stiffness, creating a vicious cycle. Ways to improve or recover your balance. While age-related balance issues are inevitable to some degree, there are numerous ways to improve balance and reduce the risk of falls. Let's start with strength training. Engaging in regular strength training can help combat muscle weakness and sarcopenia, particularly in the legs and core. You don't need to become a bodybuilder, even simple exercises with light weights or resistance bands can make a big difference. Balance exercises. Activities like Tai Chi, yoga, and specific balance exercises such as standing on one foot or walking heel-to-toe can improve stability. Research has shown that Tai Chi, in particular, is effective at improving balance and reducing falls in older adults. Proprioceptive training. Exercises that challenge your sense of body position, such as walking on uneven surfaces or using balance boards, can help improve proprioception and enhance overall balance. Even walking barefoot on different textures can stimulate the receptors in your feet. Vision and hearing checks. Regular eye and ear exams are crucial to ensure that vision and vestibular systems are functioning well. Correcting vision issues, such as getting glasses or cataract surgery, can improve balance. Good lighting in your home, especially on stairs and in bathrooms, can also make a big difference. Medication management. When it comes to medications, talk to your doctor about any balance issues you're experiencing. Adjusting dosages or switching to medications with fewer side effects can reduce the risk of balance-related issues. Staying hydrated. Try keeping a water bottle with you and setting reminders to drink regularly throughout the day. Since older adults often take medications that can lead to increased fluid loss, staying hydrated is crucial for preventing balance issues. Cognitive function. To support cognitive function, it's helpful to engage in mentally stimulating activities, learn new skills, and remain socially active. Research has shown that activities like dancing, which combine physical exercise, mental focus, and social interaction, can be especially beneficial for both balance and cognitive health in older adults. So if you're over 60 and have noticed your balance isn't what it used to be, don't just accept it as a fact of aging. Stay proactive and engage in activities that promote balance. Talk to your doctor about any medications or health conditions that might be affecting your balance. Older adults can maintain their independence and quality of life for years to come.
If you find this information helpful, please hit the like button and subscribe to our channel for more informative content.